everyone, welcome back to my channel. So today's there is an important and interesting topic, and that's perianal fistula. So in this video we are going to discuss a very important topic, and that's perianal fistula. So in this video we are going to discuss about the basic anatomy of the anal canal. Then we will be discussing about the definitions of fistulas, sinuses, and then the classification of the perianal fistula. Then we will be discussing few confusing terminologies. The internal opening is not visualized, the external opening is not visualized. And then we will look at how to report these cases, the MRI reporting format. And at last we will be practicing 2 cases. Okay, so let's start. The basic anatomy of the anal canal. So anal canal is actually the terminal most part of GIT that measures around 4 to 5 centimeter in length. Okay, so let's know about the point of division between the bowel loops. When we draw a virtual line between the superior border of the pubis symphysis up to the sacral promontory, what lies above is the colon, while what lies below is actually the rectum. Similarly, how to distinguish rectum and anal canal? So this is the puborectalis sling. What lies above this puborectalis is the rectum, what lies below is the anal canal. And this puborectalis sling is also responsible for the formation of this anorectal angle. Okay, anorectal angle. So this is the basic point of division between colon and rectum and anal canal. So the basic gross anatomy of rectum, once we see, so in the mucosa of the anal canal lies the longitudinal ridges. Okay, these are the longitudinal ridges. The lower end of these ridges have semilunar valves. Semilunar valves. If we join these semilunar valves, what we get is actually the dentate line. The upper limit of this longitudinal ridges is the upper limit of anal canal. Above this lies the rectum, and we also know here also lies the puborectalis sling encircling the anorectal junction. Okay, so this is the dentate line, and it lies in the midway of anal canal. It divides the anal canal into the upper half and the lower half. The terminal part of anal canal is known as the anal verge, which is actually the junction of the anal canal with the perineal skin. Okay, the perineal skin. So what we learned? We learned that dentate line lies in the midway of anal canal, and the extent of anal canal is between the superior border of the puborectalis sling up to the anal verge. Okay, so this is actually the rectal ampulla, the dilated part of rectum. This is the puborectalis sling. So here lies the anorectal junction. These are the anal columns, and this is the dentate line. Okay, also know that anal canal has anal glands which secrete mucosa, which secrete mucus. These anal glands are actually located in the intersphincteric space and the internal anal sphincter, and these open into these crypts of Morgagni formed by this longitudinal mucosal ridges and the semilunar valves. So these anal glands open here. We will know the importance of these anal glands secreting mucus when we learn about the pathophysiology of perianal fistula. Okay, so we now know this. Now let's learn about the sphincters of anal canal. So this is the levator ani muscle. Know that levator ani muscle has actually 3 parts: the iliococcygeus, the pubococcygeus, and the puborectalis. The same puborectalis which we saw dividing the rectum from the anal canal. Okay, so this is the levator ani muscle. This is actually the puborectalis sling. Okay, so here the superior border of puborectalis sling lines divides the rectum from the anal canal. Okay, this is the dentate line lying almost midway between the upper half and the lower half of anal canal. See, this is the circular, outer smooth circular muscle of rectum, which continues along the anal canal as the internal anal sphincter in its upper 2/3 part. So this is the internal anal sphincter along the anal canal, and this is the circular muscle of the rectum. Okay, the outer part of this internal of this circular muscle or the internal anal sphincter is actually the longitudinal muscle. Okay, now this is the external sphincter. This is a puborectalis sling, we already discussed. This is the external sphincter which merges with the puborectalis sling. This external sphincter has three parts: the deep part, the superficial part, and the subcutaneous part. Okay, this subcutaneous part, see, the subcutaneous part starts where the internal anal sphincter ends. We knew that internal anal sphincter covers just the upper 2/3 part. So the subcutaneous part of the external anal sphincter starts where the internal anal sphincter ends. Okay, so let's just see the MRI images, how these sphincters look like in MRI. So see this, these are the axial images. So this is the, see, this is the external sphincter, this is the external sphincter, this is the internal sphincter, and within it lies the mucosa of the anal canal. The fat outside this external sphincter is the ischio-anal fossa fat. What lies in between these two sphincters is the intersphincteric space. Similarly, in the MRI images, see, this is the external anal sphincter, this is the internal anal sphincter. What lies in between these two, the fat, is the intersphincteric space, and this fat is the ischio-anal fossa fat. Okay, how to differentiate these? See, the external anal sphincter is more darker, more T2 hypointense, because it is skeletal muscle, it is under voluntary control, and it is mainly responsible for the fecal continence. Okay, the internal anal sphincter is smooth muscle, is involuntary, and is responsible for just 15% of the resting anal tone. Okay, this is slightly T2 hyperintense, and on giving contrast, this external anal sphincter doesn't enhance, while this internal anal sphincter enhances. Okay, similarly, also look at these levels of cross section. When we have taken section at the level of this levator ani ending, so this U-shaped muscle is actually the levator ani muscle. Okay, anterior to it is the pelvic cavity, while posterior to this is the perineum. Okay, at this level we can see the external anal sphincter continuously surrounding it and the internal anal sphincter continuously surrounding it, forming tube within tube configuration. And this inverted U-shaped at this level, where lies just the subcutaneous part of the external anal sphincter. So this inverted U is actually the subcutaneous part of external anal sphincter. Okay, what I said, see, this is more T2 hypointense external anal sphincter, while the internal anal sphincter is T2 hyperintense, and it also enhances on giving contrast. Okay, let's know about the continuity of these muscles. So this is the levator ani muscle. This is the levator ani muscle. It we already know that it has three parts. The puborectalis part, puborectalis muscle is its part only, and then starts the external anal sphincter, which also fuses with this puborectalis sling. So all this is actually the external anal sphincter, and this is the internal anal sphincter, and what lies in between these two is the intersphincteric space. Okay, is the intersphincteric space. So again in this picture also, so this is the anal canal having the anal crypts into which the anal glands open. This is the dentate line. This is the circular smooth muscle of rectum, which continues below as the internal anal sphincter, but it lies just the upper 2/3 of the anal canal. This is the levator ani muscle having the puborectalis sling, and the external sphincter also fuses with this puborectalis sling. Okay, and this part, this fat around the anal canal is the ischial-anal fossa, while what lies by side of the rectum is the ischio-rectal fossa. Okay, this is the levator ani muscle. Above this is the supralevator part. Below this is the infralevator part. Okay, once we know this basic anatomy of the anal canal, now let's learn about the anal fistula. So now let's learn about the perianal fistula itself. So the very first thing that you should know is actually what is fistula and what is sinus. Okay, so fistula is something which has both the ends that communicates with something, a hollow organ or the skin. Okay, so like in this case, this is the anal canal and this is the perianal skin. So this will be a fistula which has communication with hollow organ and the exterior, or it can be like between the anal canal and the vagina. Okay, so these things are fistula, while sinuses have only one end which is communicating with one organ or exterior to the skin, while the other end is blind ending. Like this is the like anal canal, and there is one sinus tract. Okay, which is not opening onto the exterior. Okay, so we know the basic difference between the fistula and the sinus. Now let's learn about the pathophysiology of the perianal fistula. So 90% of the fistulous tracts have a primary cause, that is cryptoglandular theory, which states that why these fistulas occur because of the obstruction of these anal glands. We already know that these anal glands lie within the intersphincteric space and the internal anal sphincter, and these anal glands open into the crypts. Okay, into the crypts. And we know these anal glands are most abundant at the level of the dentate line. Okay, so once there is obstruction of the opening of this anal gland, when this anal gland opening is blocked, glandular secretions accumulate, and then infection and abscess formation occurs, and then this infection spreads to other tissues like the external anal sphincter or the ischio-anal fat and all. Okay, so this is the primary cause responsible in 90% of the cases, while 10% cases have secondary causes like inflammation, for example Crohn's disease, then any trauma, malignancy, then radiotherapy, any sort of infection. Okay, so but the main cause is, all we know, cryptoglandular theory or the obstruction of the anal gland. Okay, so this is about perianal fistula. Next thing that we are going to discuss is about the classification of the perianal fistula. We'll be learning all the things: what is simple, what is complex, what is high, what is low, what is internal opening, what is external opening in the next video. But here we are going to discuss about the classification of the perianal fistula. So the very first classification was actually Park's classification, and this classification was anatomical, okay, and it was mainly described on coronal section of the anal canal. So according to it, here we have 4 types of fistulas, okay, 4 types of fistulas. To describe the fistula, we have to tell about the internal opening, then its course, and then the external opening, okay, then the external opening, and during its course whether there is any secondary tract or ramification, or is there any abscess, and finally how many tracts and all. Okay, so according to Park's classification, that was the anatomical classification, we used to have 4 types of fistulas, okay. So see, all fistulas will start from the anal mucosa itself. The internal opening of the fistula will be within the anal mucosa. Okay, see, so the very first type shown here in A, so the fistulous tract has internal opening in the anal canal, then it traverses through the external opening then it traverses to the internal anal sphincter, then into the intersphincteric space, and then it finally opens onto the perineal skin, okay. So we see that the course of this fistula is through the intersphincteric space, so this is known as the intersphincteric fistula, okay. Next type is type B, okay. See, the internal opening is in the anal mucosa, almost at the level of dentate line, then it courses through anal mucosa into the internal anal sphincter, into the intersphincteric space, to the external sphincter, and then into the perineal skin, okay. So see, it has crossed both the internal as well as the external. That's why it's known as the transsphincteric, that is through the sphincters, okay. The third type is actually the suprasphincteric fistulas, okay. See the course, it starts from the anal mucosa, traverses through the internal anal sphincter into the intersphincteric space, then it goes above the level of the levator plate, and then finally it descends into the ischioanal space to the perineum, okay. So this is suprasphincteric fistula. And the last type is this one. See, this fistula has internal opening into the rectum, okay, and this courses through the smooth muscle, inner circular smooth muscle of the rectum through this ischiorectal fossa, through the levator plate, and then finally through the ischioanal fossa to the perineal skin. As this fistula doesn't cross either internal or external sphincter, so this is known as the extrasphincteric fistula, okay. There is one modified Park's classification, according to which we have one more type of fistula, and that's superficial. The course of it starts from the anal canal, and then it goes in between the anal mucosa and the internal anal sphincter, and it opens on the perineal skin. It doesn't have any relation with internal anal sphincter, okay. So these are the basic 4 or 5 types of Park's classification, which is the anatomical classification and mainly described on coronal images, okay. But now what we follow is the St. James University Hospital classification of perianal fistula, popularly known as SJUH classification, okay. So according to it so first of all, it is based on MR imaging, and that too particularly on the axial images, okay, axial images. So there is type 1 fistula, which is intersphincteric fistula, okay, simple intersphincteric fistula. See the course. So this is the internal opening, goes through the internal anal sphincter and then into the intersphincteric space and open. So it's simple intersphincteric fistula. Okay, the type 2 of this SJUH classification is this type 1 plus an abscess or secondary tract in the intersphincteric space only. Okay, see, this is the intersphincteric fistula type 1 plus abscess or branching ramification, that too in the intersphincteric space. So see, this is the internal opening, this is the tract going through the intersphincteric space opening into the perianal skin, and it has a secondary tract or an abscess in the intersphincteric space. So this is the type 2. Okay, then next is the type 3, that is transsphincteric fistula. That's simple. Okay, so see, the internal opening crossing through the internal intersphincteric space, external, and then to the perianal skin. So it is crossing both. So that's transsphincteric. Type 4 is just like type 3 with abscess or branching, and that too in the ischioanal fossa. Okay, so this is the internal opening, the tract through internal intersphincteric space, external, and with an abscess in the ischioanal fossa opening onto the perineal skin. This is type 4. Okay, and next is the type 5, which is the supralevator or the translevator part. This is the internal opening through the internal anal sphincter through the intersphincteric space, then going above the levator plate, through the levator plate into the ischioanal fossa, perineal skin, and this rectum, the inner circular smooth muscle through the supralevator part into the ischiorectal fossa, through the levator muscle into the ischioanal fossa, and then to the perineal skin. This is type 5, both supra and the translevator disease. Okay, so what we see that this SJUH classification type 1 and 2 is involved in Park's intersphincteric one. Okay, this 3 and 4 is there in Park's in the transsphincteric one, and this supralevator and the type 5 Park's involves both the supra and the extra supralevator and the extrasphincteric. Okay, so this is how we can learn about the Park's and the SJUH classification of perianal fistula. Let's see these things in the axial sections as well. So what is this? So what we can see, this is the internal anal sphincter, this is the external, and this is the intersphincteric space. So there is an abscess in the intersphincteric space. Okay, and when we trace this, then we can see the fistula. So likely this is type 2. Okay, fistula with abscess in intersphincteric plane. Then see this, this is the internal anal sphincter, this is the external, and this fistulous tract is crossing both. Okay, so this is transsphincteric or type 3. Next is, see this, there is internal opening, then crossing the internal, then the intersphincter space, then the external, and finally forming an abscess in the ischioanal fossa. So this is type 4. See this in coronal also, the internal opening, then the through internal anal sphincter, through intersphincteric space, through the external anal sphincter, and then into the ischioanal fossa. This is type 4. And then this, there is abscess. See, this is the levator ani muscle. What we learned, that above the levator ani muscle lies the pelvic cavity, while below this lies the perineum. So there is an abscess in the pelvic cavity. How this abscess came here? So this is the in the coronal section, this is the abscess in the supralevator compartment, and this is the fistulous tract. Okay, so definitely this is supralevator translevator extension of fistula, that is type 5 fistula. Okay, so once we know this basic classification, Park's and SJUH, in MRI we usually report the SJUH classification. So In the next video, we will be about basic terminologies like what is horseshoe, what is internal opening, what is external opening, and if you have any doubts, let me know in the comment section.